So at Sargas, we identified the need for patients being engaged right from the time the treatment is initiated with the patient. So we said we want to build everything in our technology that is, how do we keep the patient engaged with his therapy and deliver better care to the patient and get their symptoms right when they happen. So we are managing the patient proactively rather than the current world, which is managing in a reactive manner. When they find out that the patient's having diarrhea, shows up after 3 days or a month, and then they manage the diarrhea. We want to manage the diarrhea from the day it begins, so that the patient doesn't end up in the ER, in the hospital, and reduces the healthcare cost, and at the same time, it delivers a better patient experience, and overall survival is better because now his tumor is managed right at the time where it needs to be managed. So that's why we decided to build Sargas with patients in mind, and that was our goal. So at Sargas, what we have done is we have built everything with patients in mind, physicians in mind, healthcare in mind, and how to reduce the cost, and at the same time still get paid for what the practices are doing. So we have remote patient monitoring where we can monitor patients from their home, entire technology that feeds us all their data, which would be like their step activity, to their blood pressure, to the blood glucose, to you name it, whatever is physiological data that we need to get, whether it's their weight, whether it's their body mass index. We can get that information into our platform, and then with our cloud, physicians can review that data and get paid for it under the new codes that came out for a remote patient monitoring, which pays about $123 to $200 per patient per month. So that's an additional revenue stream that the doctors can make, but at the same time deliver the best care that we need to deliver to the patients and proactively manage those patients so that we don't reactively send them to the hospitals.